Hello, this is Dr. Avinash Borade, ENT Surgeon from Navi Mumbai. Today we are going to talk about very common topic in ENT, which is Functional Endoscopic Sinus Surgery. We call it FESS. So it is a surgery performed for a very common reason, that is sinusitis. So first we have to understand what is the complaints or what is the problem which patient faces for which functional endoscopic sinus surgery is required. So any person who is having recurrent sinusitis with the symptoms of nasal blockage, stuffiness, along with facial pain, headache, and many times some thick secretion which may be yellowish or greenish coming from nose or entering into the mouth, is having a sinusitis problem. So if this is a recurrent, we call it chronic sinusitis. So person who is coming with recurrent symptoms, recurrent sinusitis, when comes to the ENT clinic, we examine the patient and try to understand the cause of the sinusitis. Many times there is a lot of blockages because of deviated nasal septum and turbinate hypertrophies, and sometimes there are allergies also responsible to have sinusitis. So if a patient is having recurrent sinusitis, then we evaluate the patient by doing nasal endoscopy, anterior rhinoscopy, and many times by doing a CT scan. This is to understand the disease, how much is the infection inside. There are different groups of sinuses which are involved. So there are 4 groups of sinuses on each side of the face. Which are the sinuses which are involved, how much is the blockage, and what is the causing the blockage to the ventilation pathway, we have to understand. And then we advise the surgery which is called functional endoscopic sinus surgery. So what is done in this surgery is, the primary purpose of the surgery is to benefit the patient for proper breathing. There is a lack of ventilation because of the blockages of structures and infection, and patient goes into the vicious cycle because infection causes the blockage and blockage causes more infection. So we have to remove the blockage mechanically, remove the bones which is there, which is obstructing the ventilation pathway of the sinuses, and open up the sinuses, make the opening very wide so it will not get blocked again, and airway should be patent throughout. So the primary purpose is to make nose and sinuses a ventilated cavity. So that's why it is called functional surgery, because it is a endoscopically done surgery and it is to make the function of the nose and paranasal sinuses proper. So when we advise the surgery, we evaluate the patient by doing routine investigation. This surgery is generally done under full anesthesia or general anesthesia. Patient has to get admitted into the hospital. Generally 1 day admission is commonly required. After surgery we discharge the patient on the next day, and what patient can expect is a little bit of congestion or say minor blockages after surgery, which generally goes away within a week or 10 days. After surgery we generally give a nasal sprays or nasal wash to clear out the secretions and to keep the nasal cavities patent. This surgery, because done endoscopically, there is no cuts or sutures outside the nose or on the face. So there is no change in the structure of the nose, there are no sutures also. Patient generally is advised to take a rest for at least 4 to 5 days. If a person wants to work or requires to do work from home, they can do it. We advise patients to wear mask if they are going out or going in a little dusty environment or require some travel to avoid secondary infections. And after the surgery, after say 2 weeks period, there is a complete recovery. We call the patients for in the first week, do a anterior rhinoscopy examination, sometime endoscopic examination, try to clean out the crust and secretions, and in second visit also, after second week, do the similar nasal endoscopic procedures. So after 2 weeks, most of the patients do not require to visit doctors again. So if any patient is having symptoms of sinusitis, recurrent cold, and having facial pain and headaches, all these symptoms are of sinusitis. So we here at Borade ENT Clinic treat all these kinds of patients. So if anybody has these symptoms in the family, please ask them to consult ENT surgeons and get it treated. Thank you.